first outbreak in 2007 to 2008. On record, 149 cases and at least 37 people killed. We're now dealing with more than double that in a much shorter period of time.
If you're not going to have any contact with anyone from that region, any infected patients, the risk to you is almost zero. But on another level, as a global citizen, you should be very concerned.
An Ebola outbreak in Africa requires an immediate international public health response. And this is why. Hi everyone, Niall here, host of This Is Why, and we're starting the week with some pretty worrying news coming out of Africa, specifically the Democratic Republic of Congo. More than 300 suspected cases of Ebola have been identified so far. It is a brutal virus, often ending in a painful and bloody death. Around 80 have been linked to this outbreak. And it's so contagious, we could soon be looking at figures significantly higher. Cue the international response, or at least that's what you would expect. But the DRC is a part of the world in which international aid organisations often find it difficult to operate. But this Ebola outbreak simply isn't a problem we can ignore. I sat down with our health correspondent, Ashish Joshi, and our Africa correspondent, Yousra Elbagir, joining us from Johannesburg. Ashish, let's just start with Ebola itself. What is it?
Ebola is a serious infectious disease. It's caused by a group of viruses. Some viruses we've known about in the past, big outbreaks in Central and Western Africa. So it's a disease predominantly which affects the internal bleeding, the organs, but it starts off like a really mild fever, muscle ache, dehydration, all of the usual symptoms you'd expect from a viral infection, but it can develop very quickly into something much more serious, internal, external bleeding, and then attacking the organs, leading to organ failure. And then sadly, in a lot of cases, because of the high mortality rate, it does lead to death. So
is it necessarily fatal?
It's not necessarily fatal. If it's detected early enough, there are interventions because you have antivirals, because it's essentially it's a virus. There are antivirals, there are therapeutics. You can have intravenous drips treat you for the dehydration, the vomiting. But once it becomes progressed, then it's much, much harder to treat, right? If you have internal organ failure, if you're bleeding out, then the chances are that you won't be able to be saved. But it needs early intervention. Patients can end up in intensive care units. It depends on the healthcare systems involved as well. But all of this, like most outbreaks, most diseases, early intervention, right? You've got to spot the signs. You've got to treat the signs. But what I need to stress about this particular outbreak, we've had Ebola outbreaks on and off for the past 15, 20 years. But the problem with this one is we have known strains. We have the Zaire strain, we have the Sudan strain. This one is a new strain, which is much more unfamiliar. Okay, so now this wasn't picked up in time, and there are no vaccines for this strain. That's what makes this outbreak particularly concerning.
Okay, so how contagious is this? How does it actually spread?
It spreads through contact with body fluids and also through contaminated objects like bedding or needles, for example, and in rare cases through contact with infected animals like primates or fruit bats.
So not airborne?
It's not airborne. I'm glad you said that. It's not like measles. It's not transmissible through the air. It's not a virus which travels on droplets or anything else, but it is very infectious, and that's why we've had so many big outbreaks in the past. But that's when you're in contact with contaminated tissue or blood or body fluids.
Let's bring in Yousra at this point. I mean, Yousra, what do we know about the origins of this particular outbreak?
I mean, that's what makes this so dangerous and concerning, Niall, is that we don't know who patient zero is. They haven't been able to find the earliest case. They've found that the earliest suspected case was at the end of April, but they haven't been able to do the contact tracing needed to be able to find out exactly who was the first confirmed case of this strain of Ebola. And that obviously raises a lot of concerns and increases the risk. But there's also the fact that this is happening in an area where gold mining is very common. So there's densely populated towns around these gold mines, including Bunia, which is the capital of Ituri province, where there have been cases as well. So you've got a spread of people, not just across the region, but also to neighboring countries. And then you have this inability to be able to track down who the first case was, to be able to identify as many cases as possible and contain the outbreak. But a lot of people have been going to witch doctors, to places of worship, to spiritual healers, and that, again, is one of those cultural, community level issues that is going to make this outbreak hard to control.
Yeah, and in particular, given what Ashish was saying, that this is not like measles. This is not something that is necessarily incredibly easily transmissible. Look, but if you're ignoring the medical advice and you're continuing to work, to socialise, to be around other people, that's where things could get really, really tricky really quickly in the DRC.
Absolutely. And this variant, we've been told by World Health Organization officials, is very slow to detect. So there's a 6 to 8 hour window where viruses can be identified and detected, but that they're saying that the period of time it takes to actually confirm a case of this variant, of the Bundibugyo variant, is longer. So you've got people who are exposed, who are moving in the world, who may have the virus and haven't had the symptoms or have been confirmed to have the virus. But then you've also got very porous borders. You've got a lot of that kind of community education work not happening anymore, because we've seen these funding cuts, not only to the end of USAID, but also funding cuts to the UN and to smaller NGOs who do this work to try and contain these kind of outbreaks. Also, when you've got an area that survives on gold mining, a lot of people are going to want to keep working because their livelihoods, their survival is built on them mining and mining as much gold as they can. So it's a lot harder to get people to stay at home and quarantine or go to a health facility where they're concerned about essentially being trapped. Quarantine is a very worrying concept to people. They don't know how long they'll be kept. They don't trust necessarily medical doctors. And so to convince people to do that kind of self-controlled action, to go to a health facility, to declare that they may have Ebola is really hard to do.
Clearly, efforts are being made on the ground to contain this particular outbreak. But you've made the point. I mean, the borders are particularly porous. We have seen cases across the border in Uganda. What do we know about that?
I mean, we've been told that the case in Uganda, one of the cases is being quarantined at the moment near the capital. And we've also been told that we're aware that the other case, a Congolese man, died from Ebola, and we've seen reports that his body was sent back to the DRC. Now, the strain, the Bundibugyo strain, actually comes from a Ugandan district, which the virus is named after, in western Uganda, close to the border. So there is an awareness from the Ugandan authorities that they really do need to contain this as soon as possible. And then we've also seen the World Health Organization come out and actually ask neighboring countries to not close their borders so that there can be a coordinated regional response. Rwanda has closed its border with Goma, the city in eastern DRC that's held by M23 rebels. They're taking no risks, but it also, when you've got a town like Goma that's held by rebels and disconnected from the rest of the country, they could really suffer from not having that coordinated approach as well. So it needs to be dealt with on a regional and almost like a continental basis. You can't just deal with this as a localized outbreak.
Ashish, we have had this declared an international public health emergency, which I imagine is to do with the significance, the import of this particular outbreak.
Yeah, what it means, it's signalling to the international community that this is an outbreak, we're worried about it, and we need an international response. So it's not a pandemic, it's regional, it's localized. But what we do know from previous outbreaks, including the pandemic, which, when I was covering the pandemic, there was an epidemiologist who stood up and said, this is the worst nightmare. This is the runaway disease. And what he meant by that was you have an infected patient, gets on a plane and travels abroad, and that's it. It becomes international. That is probably not the situation we're dealing with here. What we're dealing with is a regional outbreak. As Yousra was explaining, migration patterns suggest that workers go between different countries, cross land borders, and that's why it's important. But why it's been declared an international emergency is because it's up to the rest of the international community now to set up its own surveillance programs, right? So where you have anyone presenting with any of the symptoms which are Ebola-like, then that triggers the international response. So it's telling the international community, we're worried about this, you need to be worried about it too, but it's not a pandemic in the same sense that, the COVID pandemic was.
Okay, but given what Ebola is, you'll forgive me for picking up on the word probably there when you were referring to this being, a regional kind of outbreak. I mean, have we seen Ebola make it to the United Kingdom before?
We have. Since 1976, there have been 4 cases of Ebola in the UK, but no local transmissions. These were all imported cases. These were health workers who went to the region. Back in 2014, I think was the last time you had somebody a health worker, a nurse who went out to Sierra Leone to work with the big outbreak there. And she became infected and brought back Ebola as an Ebola patient here, but quickly identified, isolated, treated in hospital, and full infection control in place. So we don't have local Ebola. We've had cases where it's been imported through health workers who've travelled to regions like Central and West Africa to work with patients there.
But I've got to imagine that our public health officials are mindful of what happened in the past and have taken steps to at least prepare for that eventuality.
Absolutely. In international surveillance, it's been raised by the WHO, so that means the international community has an obligation, all right? There are protocols which kick in. Border officials will be on alert for flights coming in from that part of the world, but doesn't necessarily mean that all passengers coming in from Uganda or the DRC will be screened medically. But it does mean that the international community is now on alert for imported cases.
I mean, Yousra, I saw you nodding along there. I mean, what is the extent of the international input into the controlling of this outbreak so far? I mean, who's actually running the show?
Well, the World Health Organization stepped in after reports started surfacing online. So again, some weeks after the first suspected fatality. But we've now seen the US Center for Disease Control say that they're going to be involved. They're saying that they're sending technical staff, technical support teams to the DRC, but also to Uganda, which is, I think, is going to be a very welcomed addition to the technical expertise that's required on the ground. We've also seen the National Health Minister arrive in Bunia in Ituri province yesterday and try and kind of trigger this move of people to these treatment sites that they've set up. But we are speaking to local journalists and being told that they're really restricting filming in some of these treatment sites, that they've shown up at hospitals and they've been turned away. So there's an effort from the government, the Congolese government, to really control the optics around this while they try and contain it.
I'm wondering, because you've already mentioned the United States kind of withdrawing from its kind of its global support, at least through USAID. That means by which it did pump billions into corners of the world. With the involvement of the Centre for Disease Control, I mean, should we be concerned that there aren't the buckets of cash that we have had in previous outbreaks standing by ready? I mean, how much of an impact could that have?
Yeah, we should definitely be concerned. And I think that's the WHO is concerned about the funding issues. And that's why they've moved to declare this global health emergency so quickly, because they want there to be as much money funneled to this as possible. But without USAID, you don't have the funding, but you also don't have the infrastructure, which was one of the key things around the Ebola response, the US-led Ebola response, is that it created infrastructure and it created protocol that people could kind of fall back to, and also that community education that's so important. So the fact that we are already seeing a lot of donor fatigue around issues in Africa. We're seeing the DRC continue to be impacted by conflict. So there's a lot to think about at a time where there's very little resources to deal with all of these compounding elements that make this outbreak extremely concerning.
But I suppose, Ashish, the one the one saving grace here is that we have been here before. We did have that outbreak in West Africa in 2014. Are we better prepared as a result?
Every time you have an outbreak like this, questions are raised about outbreak preparedness. We are drilled, we are better equipped, we have better infrastructure, but the sort of areas that Yousra has been describing are so remote and so rural, and there are so many other complications. We're not dealing with one cluster, and that's what makes this outbreak particularly difficult for the WHO. They're talking about a number of clusters. They don't know how many people are infected. You don't have laboratories near the epicenter, so you can't test everyone. Most people, if they're dying or if they're sick, they might not even make it to a healthcare facility. So there are too many unknowns and too many variables for this particular outbreak.
Well, isn't the thing that we most desperately need right now is a vaccine? I mean, how far away from that are we?
Vaccines are always being worked on, and then vaccines have to go through clinical trials, peer reviews. It takes a while to get a vaccine from the laboratory into the arm of an infected patient. They will be working on vaccines, right? This isn't a completely unknown strain. This strain has been known about. There have been outbreaks before, but that's what's caught everyone there on the ground by surprise. They weren't looking for this particular strain. They were looking for previous strains which have caused outbreaks in the past. So to answer your question, there will be a vaccine in the pipeline. Is it ready to be deployed right now? I doubt it.
I mean, Yousra, do you get the impression that we have been quicker to deal with this particular Ebola outbreak than we were 10 years ago, more than 10 years ago, I should say?
We're dealing with a different variant, right? And even looking at the outbreak of this specific variant, the first outbreak in 2007 to 2008, it was on record 149 cases and at least 37 people killed. That was between 2007 and 2008. We're now dealing with more than double that in a much shorter period of time. We need to accept that we actually don't know much about this strain. Time will show us how bad it is.
Ashish, let's just end with just a little bit of reassurance, noting, as both you and Yousra have said, just how horrible an affliction, a condition, an illness this is. How concerned do we genuinely have to be in this part of the world about what is taking place in DRC, in Uganda, and presumably, potentially, other parts of Africa very, very soon?
Okay, so there are two levels to this answer. As an individual, you don't need to be worried at all, I would say, because if you're not going to have any contact with anyone from that region, any infected patients, the risk to you is almost zero. But on another level, you, as a global citizen, you should be very concerned about international outbreaks of deadly diseases, because as an international citizen, we know...
As a human being.
As a human, exactly that, all right? Because we know now, because of the lessons learned from 2020, the world is a connected, interconnected place. Nobody would have worried right now about a fish market in Wuhan had we not had the pandemic. We need to make sure that the global health systems all support and work together. And when we have an outbreak like this in Central Africa, that the international community can mobilize and support, because ultimately, if you have failing health systems who aren't supported, then it comes back, and it comes back hard to impact all of us around the world.
And that is your lot for today. Much more available on the website, including up-to-the-minute details of the scale of the outbreak. Do get in touch with your thoughts, and indeed if you have been personally affected by what you have heard. Perhaps you know people in the region. Why@sky.uk is the email. We're back tomorrow.